Hi there, I'm Anne Kpason from WICA, and I'm thrilled to take you on a journey through our groundbreaking work in gender-based violence response. Here's an overview of how we have made a difference in Nigeria starting from 2019 and why it matters. As part of the USAID Nigeria Integrated Health Program implemented by Palladium, WICA played a pivotal role as a lead on gender equity and social inclusion. IHP's efforts spanned across Ebonyi, Bauchi, Kebbi, Sokoto, and Federal Capital Territory, aiming to contribute to state-level reductions in child and maternal morbidity and mortality. WICA collaborated closely with Palladium and other USAID implementing partners, national, state, and local stakeholders such as the federal and state ministries of health and women affairs and the national and state primary healthcare development agencies to lead initiatives to integrate gender equity and social inclusion principles into healthcare delivery alongside comprehensive gender-based violence response interventions and more. A significant aspect of our work centered around male engagement, which substantially contributed to our gender-based violence response. So at the program's inception, WICA conducted GESI text review and policy analysis at the national and state levels. Findings from the analysis were disseminated to stakeholders, leading to the development of state GESI strategies and action plans, which responded to the diverse challenges identified through the text review. These action plans guided the implementation of GESI integration across the program at both national and state level. Some key components of the action plans encompass training healthcare providers, strengthening referral systems, advocating for the adoption of legislation such as the Violence Against Persons Prohibition Act and the Child's Rights laws, and also activating multi-sectoral gender-based violence TWGs and response teams across the 5 IHP supported states, with concurrent efforts to engage men as clients, partners, and agents of change.
In collaboration with the Federal Ministry of Health, one of our most significant achievements was enhancing the clinical and non-clinical capacity of healthcare workers through the tailored training and mentoring of 2,879 healthcare workers and 179 master trainers across 1,031 healthcare facilities in the 5 supported states.
We supported the Federal Ministry of Health to develop a national gender-based violence training curriculum, which ultimately standardized gender-based violence training content and response from the national level to the state level for frontline healthcare workers who respond to survivors of GBV in health facilities. This training curriculum highlights how to identify survivors of gender-based violence, how to manage cases, make referrals for other services, and document appropriately in relevant national data reporting tools in these health facilities. The gender-based violence training resulted in identification of 48,584 survivors of gender-based violence across the 5 states. Of these individuals, 39,300 survivors received post-GBV care, and 3,554 were referred for further services such as protection, legal, psychosocial support, and shelter. By leveraging the capabilities of frontline health workers, gender-based violence case identification and response were improved, ultimately ensuring that survivors can receive comprehensive and holistic care in primary healthcare centers. The training also focused on increasing healthcare providers' skills in integrating gender-based violence into reproductive, maternal, newborn child, and adolescent health, plus nutrition and malaria services, which are entry points to gender-based violence case identification in health facilities. Our journey wasn't without hurdles. We initially faced challenges in implementing comprehensive gender-based violence response interventions, particularly in overcoming social-cultural barriers deeply entrenched in healthcare workers and within the communities we served. But when there are challenges, there are also opportunities for innovation and impact. Our team of GESI advisors, including myself, played a pivotal role in addressing the gaps and overcoming the obstacles by increasing stakeholders' awareness through interactive and transformative values verification sessions, which demystified social-cultural issues in healthcare system and communities. Additionally, we approached gender-based violence in the healthcare facilities from targeted health talks through institutionalizing gender desk officers and gender focal persons at the state, local government, and healthcare facilities, whose roles are to provide post-GBV care to survivors and also ensure proper documentation and reporting. WIHA, in collaboration with state stakeholders and healthcare workers, developed, validated, and launched a code of conduct on sexual exploitation, abuse, and harassment in the workplace for healthcare workers, which is an addendum to the State Human Resources for Health policy, so that healthcare workers themselves were protected from gender-based violence. WIHA also coordinated gender learning labs within health facilities, which provided spaces for healthcare workers to identify health priorities and gaps in access and utilization of services. These labs helped promoted and provided healthcare workers with the opportunity to identify challenges, including stigma surrounding survivors of gender-based violence in communities and a significant lack of comprehensive services for survivors in health facilities, including identification of survivors of gender-based violence and data documentation. With our team's efforts, key stakeholders developed state-level male engagement in health action plans to address the unique challenges and barriers to healthcare, which is often experienced by women and children. WIHA also led collaborative approaches to coaching healthcare workers to engage men as supportive companions for their partners and children in accessing care, as well as they themselves being recipients of healthcare services. By approaching men as male champions and as clients themselves, we catalyze the shift in gender norms, laying the foundation for a more equitable and resilient healthcare system. Following these efforts in the FCT, from January 2023 to March 2024, we saw a 126% increase in men accompanying their partners to antenatal care appointments, and a 5,250% increase in men accompanying their children to immunization appointments. As male participation in antenatal care, family planning, and immunization appointments increased, so did the attendance and access to these services. But our work doesn't stop here. Our commitment to sustainability extends beyond project timelines. Working with local stakeholders, we champion state-level advocacy for the development of gender-sensitive health policies and the addition of GESI and GBV activities in state budgets and annual operational plans. In collaboration with the federal and state ministries of health and women affairs, WISE has supported state-level technical working groups to develop and operationalize the National Gender in Health policy and action plan for health sector response to gender-based violence. WISE has also developed state-level gender-based violence referral pathways in collaboration with stakeholders at various levels, and is supported in establishing and strengthening sexual assaults and referral centers in these states. These sexual assaults and referral centers are one-stop shops for gender-based violence response. WISE has supported in harmonizing GBV data indicators and reporting tools, which are addendums to the NHMIS version 2019, and also testing of these indicators on the DHIS tool, which is currently undergoing review in the country. By involving stakeholders at all levels in planning and implementation, we fostered a sense of ownership and accountability, ensuring that our efforts continue to thrive long after our project concludes and transitioned ownership to state and national level government bodies through sustainability plans. For example, the State Ministry of Health and Women Affairs committed to continue coordination and monitoring, and also ensure funding of GESI and GBV activities in these 5 IHP-supported states. Additionally, the Federal Ministry of Health and Women Affairs confirmed their commitment to supporting and following up with these states to ensure reporting of GBV data on the revised DHIS tool and the National GBV dashboard. Thank you for joining me on this journey. Together, we're making strides in integrating GESI concerns in Nigeria's healthcare system and improving Nigeria's GBV response. Let's continue to champion change and build healthier and more inclusive future for all. Thank you.